So you want to go to NP school to be a nurse practitioner, but you're either finishing up your nursing degree and don't have any nursing experience yet because you haven't graduated, or you have a totally non-nursing bachelor's degree and would like to just go straight to being an NP. Can you do this? If so, how? And what do I usually recommend in case you care? This is easily one of the questions that I get asked the most, but I've honestly put off making a video about it because I know it's a super hot topic and people like to get all fired up about it, but 9-month pregnant Liz is feeling very bold. So here we go. Quick reminder before we dive into this, you do you, friend. I'm gonna lay out some facts for you and then I'll finish up with my opinion on the whole topic because like I said, I get asked about that a lot. But my opinion is just that. It's my opinion. It does not have to be yours. We can have different opinions and still be good. Let's just remember all that, okay? I feel like I'm like teaching a kumbaya class. All right. Golden, we're all on the same page now, we can proceed. If you're new here, welcome, I'm Liz, I'm a family nurse practitioner, and before I did all that, I was a inpatient nurse on a pediatric cardiology floor and an adult med-surg floor. And I do a mixture of content videos on Tuesdays that are usually about nursing and NP stuff, and then on Saturdays, I have a weekly vlog where I just document my life in and out of work as a family nurse practitioner. So if this is fun, that sounds fun, consider subscribing, I'd love to have you. All right, first question. Is nursing experience required in order to become a nurse practitioner or go to NP school? This is mostly geared towards people who are finishing up their nursing program and want to piggyback NP school onto the end of their program, pretty much like you graduate from nursing school in May, I want to start NP school in the fall type of thing. Answer. It totally depends on the program that you go to. However, there are definitely many programs out there who will accept you without having any experience. The one that I went to required at least 1 year of nursing experience, so you couldn't piggyback it, but I know there are many programs that do not have that requirement. I thought for each of these options, I would kind of explain how long each of these paths took just to give you a little bit more information about it. So if you're piggybacking your NP right after your nursing degree, if you do a full-time NP program, you're looking at 2 to 3 years, depending on if you do a master's or a doctorate program. And if you do school part-time, then you're looking at 3 to 4 years, again, depending on if you get your DNP or your MSN. If you're kind of having questions between the whole DNP versus MSN thing, I do have a whole video where I talked about that. I will leave it down in the description below. And I should also mention that when I say your nursing degree, it could be your ADN. There are even programs out there now that take you from your ADN to your NP, bypassing the BSN part. Majority of programs are BSN to NP, so assuming that you have your bachelor's. But again, there is that option to go from ADN to your NP, skipping that BSN in the middle. Next question. What if I don't have a nursing degree at all? Can I just go straight to being an NP? And again, the answer here is yes. There are things called direct entry NP programs, and they take you from a non-nursing bachelor degree to your NP via your MSN or your DNP. These programs are usually divided into your nursing chunk in the beginning and then the NP chunk is at the end. The beginning part is kind of like an accelerated nursing program. However, most of the programs do not grant you a BSN along the way. It's just kind of, you have to get those classes in the beginning because then you take your NCLEX, which is the licensing exam for registered nurses. After you do those nursing chunks, you do have to take the NCLEX. You have to take the licensing exam for a registered nurse because to be an advanced practice registered nurse, which is what an NP is, you have to first be a registered nurse, if that makes sense. And the first part of these programs are usually like 1 year to 1.5 years, at which point you take your NCLEX. And then the second part, which is more NP related, is usually 2 to 3 years. And again, that time is gonna vary based on if your program's a master's or a doctorate program. Most of the direct entry NP programs that I found when I was researching and just from people I've talked to are full-time. I did find like 1 or 2 part-time options, but overwhelmingly they were full-time, which is different from the programs we just talked about with the BSN to the NP. A lot of those programs are at least offered part-time. That's what I chose, was to go part-time in school. It's a much more popular option. So that's just something to think about too, is if you have the capability to dedicate yourself to school full-time, as this is what most of the direct entry NP programs are. And those are the basic routes to applying to NP school without any nursing experience. Now, A lot of people do end up getting nursing experience along the way while they're in school, just not before they apply to school, if that makes sense. So you may graduate from your BSN program, start your job as a new grad nurse in June, and then start your NP program in the fall. So by the time you graduate, you'll have a few years of experience working full-time or part-time, whatever floats your boat. And it's the same thing with the direct entry program. From people I've talked to who have done these programs, it is highly, highly encouraged to start working as a nurse after you pass that NCLEX, after that beginning nursing portion. Again, most of the time, since the programs are full-time, I've found people tend to work part-time or per diem during the remainder of the course, but people do usually work as a nurse, as it's very encouraged by the programs. There you go. So there's the can you and how long will it take? Yes, and a while in both cases. And if that's all you really wanted, this would be a wonderful time to leave. But if you want to hear what I would personally recommend if you were my friend and you came to me and you were asking for my opinion, then feel free to stick around. Just remember, like I said before, I see people losing their minds literally all the time on different forums and Facebook groups and Instagram about this topic, and I just don't want to do that here. So if you feel like you're gonna get all heated up and like bothered, it's probably not the place for you. So if you were my friend coming to me and saying, hey Liz, do you think I should apply to NP school even though I don't have any nursing experience quite yet? My answer would be no. Is that to say that people who do go that route are bad providers? No. I just think there are some serious benefits to getting some nursing experience before you go and enter advanced practice, and I'll talk about a few of the reasons why here. One, you may find something totally different that you are interested in that you want to then dedicate the rest of your career towards, sending you in a very different direction that you would not have known about had you not been working. For example, when I graduated from nursing school, had no idea that I wanted to become a nurse practitioner. That wasn't really on my radar. However, if you had asked me what kind of NP would you be if you went back now, I would have hands down said pediatric outpatient or a neonatal NP. And as you can recall from a few minutes ago, I am a family nurse practitioner working in family medicine, which really would have probably sounded like my nightmare at the time if you had asked me graduating from nursing school. But I ended up getting into this because my first job really opened my eyes to the lack of preventative health care and education, mainly in primary care. And I was like, ooh, I wanna go and do that so that people don't get to my floor with their toes falling off type of thing. That totally changed the direction of my entire career, and I never would have known that if I had just hopped right in, even if I thought I was like dead set on it. I have seen a lot of people in my own life going into NP school and then gaining a little bit more nursing experience and then totally like changing paths completely because something new came up. They were exposed to something else, or like me, they just realized, oh, actually this is where my passion is. So for that reason, I'm a huge believer of just diving in and getting your feet wet for at least like a year and just seeing, what do you like? What direction might you have not thought about before? Dip your toes in and just see what you like. You may be surprised and maybe even delighted in the new direction that it takes you. The second big reason I recommend nursing experience before NP school is, even though the roles of being a nurse and a nurse practitioner are very different, you gain so much experience and countless skills that will then apply to your role as a provider by working your nursing job. I learned so much about critical thinking in a healthcare setting, how to put the different constellations of patients' symptoms together in my head coming towards a diagnosis, how to educate and advocate for my patients, how to identify warning signs. You develop that gut feeling of like, oh, this is really bad, or like, this isn't, I'm not like panicking yet. And I really, really nailed down how to communicate and listen to patients. In total, I was a nurse for 6 years before I graduated from NP school. And even though at the time I didn't necessarily see until the very end really that like, I am learning a lot from this and it's going to help me so much in my NP role, you just absorb so much without even realizing it that I cannot encourage enough to just get a little bit of extra time before you dive into NP school. I know in myself it was super helpful, and I also saw a big difference in people that I've worked with and precepted who have had more experience versus less. There's a lot more confidence. Again, there's just a little bit more critical thinking, putting things together. It comes together a lot easier for people with more nursing experience. So not to say that you can't do that if you don't have it, but it certainly is much easier for those who are coming in with, like a few years of being in the ER under their belt. And if you're interested in becoming a family nurse practitioner, and you're kind of like, I don't even know what nursing experience I should get if I'm looking at getting it, I made a video going over the most beneficial nursing specialties that would be really helpful prior to becoming an NP. I polled a bunch of people, talked to like half the world, compiled it into that video, and I'll leave that link down below as well. Third reason, I just don't feel like you get enough clinical hours in NP school if that's your only experience in healthcare. Now, obviously you could be coming at this from being like an MA or something else in the healthcare field where you've gotten healthcare experience, and that would certainly be helpful. But NP school clinical hours are usually between 700 and 1,000 hours. Some are even like a little bit less. And that's all of your clinical, and then you go out and you take care of other humans. Now, going back to nursing experience does not equate NP experience. This is the big thing I hear over and over, like this is not equitable. I know, I hear you, but like I said, I really gained so much critical thinking and just exposure and insight and all of that I never would have had. So I was able to recognize things a little bit easier, I think, than maybe someone who hadn't had all of that experience. People will never agree on this because, like I said, there's the whole argument of like nursing experience doesn't equal NP experience. But I personally feel like my thousands of hours working as a nurse did benefit me and make me a little bit better prepared versus if I had not had it. And I just don't feel like if I was going into my role as an NP that I would have been very successful if I had only had 700 to 1,000 hours. Like that is just not enough to then be in command of someone's healthcare, in my opinion. And I do know some schools do more. I have heard of some direct entry programs especially that give you way more hours because they're trying to compensate for them. But again, that is not the norm. Most still have kind of 700 to 1,000. But if your school, if you've done this and your school had a bunch more, leave the school name in the comments below because that would be super helpful. I have seen a few, like I said, or heard from people who said, oh, my school did a lot more because they recognized that we don't have those other hours built into our previous healthcare experience. And again, I am not saying that people without previous nursing experience go into this and don't make great healthcare providers, or that if you go in with experience that you're automatically going to be great. Absolutely not. I have definitely seen it go both ways. I've seen people with no experience come in and like totally rock this thing. And then I've seen people who are like, have been a nurse for like 10 years and you're like, ooh, okay. This is gonna be interesting. So I can only say from my experience working with different people, precepting, and then just working alongside, it seems that if you have a little bit of nursing experience, it does benefit you and make you a little bit maybe even just more comfortable in your role as a provider. But one of the problems here is we don't have any data to back any of this up. It's always just like word of mouth. Like I feel like in my experience, people who have had more nursing hours are like maybe more prepared in clinical, but like that's just my opinion, like from what I've seen. We have not done any studies to say, hey, people who graduate from these programs aren't as good of aren't providing the same level of care. We don't have anything saying that. So I really feel like none of this even truly matters until we have some kind of data that we can look at and be like, oh yeah, like nursing experience does help, or hey, who knew? It doesn't. So I fully admit that. This all could be anecdotal. And again, I'm not telling you if you do this that you're gonna be bad at your job. It's all gonna be fine, friends. I know some very delightful and smart people who have gone this route and they seem really great. So perfect, wonderful, awesome. You do you, friend, you do you. And the fourth reason I would probably recommend some experience before NP school would be, and this is mostly for people who are piggybacking their NP onto their BSN, that first year as a nurse is like really brutal. You are learning an insane amount of stuff at your new job. And then grad school is just like an insane amount of other new stuff. I just feel like there's not enough room in your brain to let the two battle it out. I know I was stressed. I cried a lot during that first year as a nurse. It was an overwhelming time in my life. And if I had added grad school on top of that, that would have been really, really rough. So just be kind to yourself. Your mental health is important. Consider even just taking a year in between to kind of like allow your brain to do one thing at a time and acclimate slowly, because your mental health is important. Now that you've gotten my opinion on that, I do want to throw out what my recommendations are usually for people if they come to me and they're asking like, hey, would you do this? And I'm like, not really. And then they're like, okay, well, what do you recommend? Here's what I would tell you if you were my friend coming to me and asking me this. If you have your heart set on being an advanced practice provider and you just aren't sure like how this is all gonna come together. First, you could just get at least like 1 year of experience. My personal recommendation is 2. I think 2 is, I had 2 before I applied and then 3 before I went in, and I thought that was a really good amount of time and not too long in the grand scheme of things. I feel like it gives you enough time to kind of get your feet wet, kind of look and see like what other direction you might want to go into. It exposes you to plenty of the stuff, shows you some new things in your profession. Like maybe you discovered a whole new branch of nursing that you didn't even know it could exist, like, and now you want to go and become a nurse educator, something like that. Gives you some time to get settled into your new nursing role and get comfy there so you can tackle like one thing at a time. But if you're not even into 2 years, like even 1 year would just be great. And then at that 1 year mark, reevaluate, hey, is this still really the direction I want to go in? If so, perfect, full steam ahead. And if not, you can like reroute and set your sights on new things and save yourself like tens of thousands of dollars and lots of tears. One thing here is I feel like a lot of times people are so focused on like, I need to be done by the time I'm like, I don't know, like so young. Like, guys, it's not a race. Like this is not a race. Whatever experiences you gain along the way are only going to help you in the long run. And I feel like sometimes we get a little bit like, I need to finish this as soon as I can versus like, I need to finish this in like a quality way. You know what I mean? Like rather than making it a sprint, like let's just see how much we can kind of gain along the way, how much we can carry along our trip, not how fast we can get there. It really is okay to take your time. At the time, I know it seems like a year or 2 seems like forever, but I promise a year or 2 is really not forever. It's really not long at all in the grand scheme of things. Second, and this is like, you know, against the nursing gods, you could go to PA school. This is more for people who like want to be an advanced practice provider but don't have their nursing degree yet, I would say. Think about PA school. I think it's a really great option. They give you almost double, sometimes triple the clinical hours that a nurse practitioner has because they know you don't have that nursing experience. I feel like NP school still is kind of based on the idea that you have nursing experience, at least in terms of how many clinical hours they offer, whereas NP school, they know you don't. I mean, some people do have nursing experience or other healthcare experience, and you have to have 1,000 hours of patient contact before you even get into NP school or PA school. That's a whole different thing. But they give you a lot more clinical hours because they know that you haven't worked in healthcare yet. And I will say they do have a lot more hours also because they're not specialized. NP school can have slightly fewer hours because they're only teaching you about primary care, outpatient, you know, stuff, whereas PA school teaches you like all the things. So your scope isn't quite as limited, but this is an option, and I think it's a really good one. The extra clinical hours will be phenomenal. You'll get a chance to see like all the different things that maybe you would want to go into as a provider. I think it's a cool option. If you're curious more about what is an NP versus a PA and what's a good way to kind of work through that in your head, like, oh, maybe this would be a good option for me. Again, I have some videos on those. I'll leave those linked down below. But keep it in the back of your mind. If you don't have your nursing degree yet and you're thinking about this, I think being a PA is a really great option. Even if you have your nursing degree, I think being a PA is a great option depending on how you want to end up practicing, if you know what you want to get into. If you don't know what you want to get into, this is a great option, friends. Just saying. Okay, well now that I've probably offended half of you on accident, there's my opinion on that. And like I said a million times, I feel like in this video, guys, you just do you. Whatever works for you. I just get asked this question all the time, and this is what I tell people, so I thought I would make a video about it because obviously people want to know. So there's my opinion on it. I really do hope that sometime in the future they do some research. Someone out there, please, one of you do research on outcomes if you have nursing experience versus not, because then we could like back this up with data rather than like, well, this is what I think. I like data. Let's just, one of you, please, for goodness sake, do this as your research project in your program, okay? Figure this out for me. Thank you. And that's that, guys. Hopefully this cleared a little bit of this up for you, answered some questions, and now you know my opinion on the topic. If this video was helpful for you and you want to see more like it, again, consider subscribing. I have content videos on Tuesdays, and head over to Instagram where I post lots of goodies of what I see and what I'm learning at work. We can chat, it's a good time, all that good stuff. Question of the day. I'm kind of afraid to even make this the question of the day, but like, what are your thoughts down below? What kind of program did you go to? Did you go to a direct entry program? You know, like what are you thinking on all this? But be kind. Be kind in the comments, friends. Interested, excited, and terrified to see what you have to say below. Hope you have a fabulous rest of your week, and I'll see you next time. Bye.